What's up, nursing students? If you're testing soon, don't skip this video. These are the exact high-level NCLEX scenarios students miss the most. Learn them now before you walk into the examination room. Are you ready? Let's start. Question number 1. A 72-year-old patient with chronic COPD becomes increasingly lethargic. The ABG is pH of 7.25, PaCO2 of 78, and a bicarb of 38. What condition best explains this presentation? So I'm going to give you 10 seconds to answer this. Okay, are you ready? The correct answer is letter B. High CO2 plus low pH plus elevated bicarb gives us an acute decompensation on chronic CO2 retention. Letter A is incorrect because metabolic acidosis would show low bicarbonate level. C is also incorrect because alkalosis is not present. And D is also incorrect because there is no alkalosis in the lab. How was it? Okay, so are you ready to go to question number 2? Let's go to question number 2. A 58-year-old post-operative patient develops sudden dyspnea, tachycardia, and sharp chest pain. Oxygen saturation drops to 82% on supplemental oxygen. What is the most likely cause? 10 seconds. Okay, when you're ready, let me reveal to you the correct answer. The correct answer is letter A, pulmonary embolism. So sudden onset plus high risk post-operatively plus phleuritic pain equals classic signs of PE. Letter B is incorrect because atelectasis is gradual and less dramatic. C is also incorrect because effusion does not present abruptly. And D is also incorrect because airway obstruction presents with stridor, not pleuritic pain. Let's go to question number 3. A 61-year-old patient with pancreatitis has severe epigastric pain, hypertension, and flank bruising. What complication is most consistent with this picture? 10 seconds. Okay, so the correct answer is letter B. So when you have hypertension plus ecchymosis is equal to hemorrhagic pancreatitis. Letter A is incorrect because obstruction does not cause bruising or shock. Letter C is also incorrect because gastric erosion does not explain the flank discoloration. And letter D is also incorrect because biliary retention leads to jaundice, not ecchymosis. Question number 4. Are you ready? Let's do it. Right? Question number 4. Okay. So a 70-year-old patient with heart failure shows cool skin, weak pulses, confusion, and urine output of 12 ml per hour. What process best explains this condition? 10 seconds. Okay, so the correct answer for question number 4 is letter C. So when you have low cardiac output, it's going to show hypoperfusion, and this usually presents with oliguria, confusion, and cold extremities. Letter A is incorrect because hepatic congestion does not explain global hypoperfusion. And letter B is also incorrect because fluid shift cannot fully explain the neurologic changes. And letter D is incorrect because excess preload would cause pulmonary symptoms first. Let's go to question number 5. A 45-year-old patient presents with fever, severe headache, and neck stiffness. Flexion of the neck results in automatic hip and knee flexion. That gives you an idea there, right? So what does this assessment indicate? 10 seconds. Okay, y'all, the correct answer is letter C. Positive Brudzinski sign is suggestive of meningeal inflammation. Letter A would be incorrect because it would not cause reflex flexion. Letter B is also incorrect because encephalopathy does not produce this reflex. Or letter D is also incorrect because spasm is not triggered by passive neck flexion. So we're in question number 5. If you're able to subscribe to the channel, I'm new to YouTube, so I'm trying to get more subscribers here so that we'll be visible to many nursing students worldwide. So let's go to question number 6. A patient receiving blood transfusion develops fever, flank pain, and chest pressure 10 minutes into the infusion. What reaction is most concerning? 10 seconds. Oops. 10 seconds. The correct answer is letter B, sudden onset. So you have that sudden onset, you have fever, you have flank pain. That tells us that it suggests there is acute hemolytic reaction. Letter A is incorrect because delayed reactions occur days later. C is also incorrect because allergies cause itchiness and hives. And letter D is also incorrect because febrile reactions do not cause pain. Let's go to question number 7. A 53-year-old patient with type 1 diabetes begins IV infusion for DKA. 2 hours later, potassium drops from 5.2 to 3. What mechanism caused this rapid decline? Okay, so the correct answer for question number 7 is letter A. Insulin drives potassium intracellularly. That's why there is a decrease in potassium level. Letter B is incorrect because aldosterone is not responsible for acute change such as this. Letter C is also incorrect because perfusion improves slowly, not in this dramatic fashion. Letter D is incorrect because GI shifts do not cause this pattern. Question number 8. Let's look at it. A 78-year-old patient with cirrhosis shows tense abdominal distension, bulging flanks, and shifting dullness. What condition do these findings suggest? Ten seconds there. Correct answer for number 8 is letter A. So these are classic signs of ascites from portal hypertension. B is incorrect because adhesions do not cause shifting dullness. C is also incorrect because gas causes tympany, not dullness. And letter D is incorrect because edema does not cause fluid wave. Question number 9. A 49-year-old patient on chemotherapy develops fever or oral ulcers and WBC of 600. What is the most urgent condition? So correct answer is letter A for number 9. Severe neutropenia. These are classic signs of severe neutropenia because there is a life-threatening infection in there. So high mortality risk if infection progresses. Letter B is catabolism occurs, but it is not the immediate threat. C is also incorrect because GI effects are not the primary risk. And D is also incorrect because anemia matters. Yeah, we know about that, but infection risk is life-threatening in this particular scenario. Question number 10. A 28-year-old patient with suspected appendicitis suddenly reports relief of pain followed shortly by guarding and tachycardia. What event most likely occurred? 10 seconds. Okay, the correct answer is letter A. Sudden relief equals there is rupture and then rigidity. When we see that, the rigidity is the classic sign of perforation. B is incorrect because gas shifts do not cause guarding. C is incorrect because smooth muscle relaxation that does not cause tachycardia. And letter D is also incorrect because partial obstruction causes cramping, not sudden relief. How's everybody doing? We finished 10 questions. How are you so far? How many questions you got right? Okay. So like I said, if you're able to, please subscribe to the channel. I'm new to YouTube. Question number 11. 67-year-old patient with long-term standing COPD becomes acutely agitated and repeatedly removes the oxygen mask. The ABG is as follows: 7.26 your pH, PaCO2 of 82, oh, that's too high. Bicarbonate is 37, PaO2 of 55. What interpretation best explains this deterioration? I'll give you 10 seconds there. Okay, so question number 11, the correct answer is letter C. This is a very high CO2. And then couple that with lethargy and agitation, this gives you a signs of acute CO2, narcosis. A is incorrect. The bicarbonate is high, not failing. B is also incorrect. Would lower PaO2 but not raise CO2 this sharply. Letter D is also incorrect because overventilation would lower CO2. Let's go to question number 12. A 58-year-old patient with sepsis develops cold skin, mean arterial pressure of 54, and a capillary refill of greater than 4 seconds. Lactate is 6.2. What condition is most consistent with these findings? 10 seconds for you. So the correct answer for number 12 is letter D. So hypotension plus cold extremity plus high lactate equals late septic shock. A is incorrect because early septic shock presents warm, not cold. B is also incorrect because it is not consistent with poor peripheral perfusion. C is also incorrect because oxygen such as utilization impairment occurs, but perfusion failure is primary. Question number 13, let's go there. A 45-year-old patient with sudden onset right-sided weakness has a blood pressure 192/104 and irregular pulse. What is the most likely cause of these findings? 10 seconds. Okay, so question number 13B is the correct answer. Irregular pulse is actually atrial fib that increases the embolic stroke risk. A is incorrect because hypoperfusion causes syncope, not focal deficits. C is also incorrect because vasospasms doesn't produce unilateral deficits. And D is incorrect because demyelinization is gradual, not sudden as what the question is presenting. Question number 14 for everybody. A 52-year-old patient with severe abdominal pain has amylase of 590, a live base of 1200. The patient is hypotensive and has abdominal distension. What physiologic process best explains this lab and exam findings? 10 seconds. So the correct answer for question number 14 is letter A. So enzyme-mediated autodigestion plus your vascular leakage is going to give us hypotension. B is also incorrect, is definitely incorrect because would cause jaundice, not profound hypotension. C is incorrect because acid production doesn't really explain elevated enzymes. And D is also incorrect because ischemia would not produce high lipase level. Question number 15. A 34-year-old patient with suspected meningitis becomes increasingly somnolent. Vital signs are 168/64, a heart rate of 48, with an irregular respiration. What condition is emerging? For question number 15, 10 seconds. So the correct answer is letter D, Cushing's triad, that shows with high blood pressure, low heart rate, and irregular breathing. That's Cushing triad for us. That is suggestive of rising ICP. Letter A is incorrect because alkalosis does not cause bradycardia and irregular respirations. Letter B is also incorrect because ICP increases cerebral pressure but reflexively increases the blood pressure. So it's exactly the opposite. C is incorrect because it's not linked to these vital signs changes at all. How's everybody doing? I know we still have 5 more, and stick around at the end because I'm going to show you a study guide that would definitely help you. Question number 16. A 69-year-old patient receiving a blood transfusion develops chest tightness, fever, tachycardia, and back pain within minutes. What mechanism most currently explains this reaction? 10 seconds. Okay, so if you chose C, that's the correct answer. So remember, with acute hemolysis, you're going to have fever and pain and tachycardia early in the transfusion. Letter A is incorrect because plasma mismatch causes mild itching, not a severe reaction. B is also incorrect because febrile, non-hemolytic reactions lack back pain. And letter D is also incorrect because pressure changes does not really explain fever or pain. Let's go to question number 17. I think we're in 17 right now. A 76-year-old patient with chronic kidney disease presents with muscle cramps and prolonged QT. The calcium is 6.7. What imbalance best explains these mechanisms? Or should I say these findings? So B is the correct answer. So low calcium is going to give us neuromuscular irritability and at the same time prolonged QT. A is incorrect because bicarbonate does not cause QT prolongation. C is incorrect because hyponatremia causes confusion, not QT changes. And D is incorrect because magnesium affects QT, but chronic kidney disease often raises magnesium. Question 18. Question 18. A 49-year-old patient receiving chemotherapy develops fever, tachycardia, and profound fatigue. WBC is 700. What outcome now poses the greatest immediate threat? So with this particular scenario, letter D is the correct answer because that's the most important thing to worry about. When you have neutropenia, which is less than 1,000, it's going to be life-threatening infection risk. And we have 700 in there, right? A is incorrect because platelet function is not the critical issue here. B is incorrect because nutrition is secondary, not emergent. C is also incorrect because oxygen delivery is adequate unless anemia is present. Question number 19. A 51-year-old patient with type 2 diabetes reports burning foot pain that worsens at night. Pedal pulses are intact. What underlying mechanism best explains these symptoms? 10 seconds. Okay, if you chose letter A, you got the correct answer. Neuropathy causes burning, tingling, and nighttime worsening. It gets worse at night. B is incorrect because venous issues causing swelling, not burning. C is also incorrect because fluid retention does not cause neuropathic pain. And D is also incorrect because muscle oxygen deficit causes cramping, not burning. Let's go to question number 20, our last question. A 35-year-old patient with acute abdominal pain suddenly reports complete relief. Shortly after, the patients develop abdominal rigidity and tachycardia. What event most likely occurred? 10 seconds. So C is the correct answer. Sudden relief means that there is rupture, peritoneal irritation. That's why we have tachycardia and rigidity. A is incorrect because contraction does not cause rigidity. B is also incorrect because herniation causes persistent pain but not relief, then worsening. D is also incorrect because vessel compression does not really cause scarring. So if you're fixing to take your NCLEX or you have taken your NCLEX and you were not successful, I recommend using this NCLEX-RN guide that you can find in my Linktree account. You can look at it in my YouTube page, or if you can't find it, you can find it in my TikTok account. Thank you for watching.